Mr. Braley for an opening statement.
Thank you, Mr. Chairman. Even though the focus of this hearing is on rate increases by Anthem Blue Cross, what we're really talking about is a problem that affects people all over this country, because it's not a new problem. And the point has been raised about health insurance reform versus health care reform. I've always stressed the need for comprehensive global health care reform, and we cannot afford as a country not to move forward with health care reform. Even though this hearing is focused on Anthem Blue Cross in the state of California, this very same issue is affecting my constituents and client in Iowa. Last week, Wellmark Blue Cross Blue Shield, the largest health insurer in Iowa, announced it would raise rates an average of 18% for Iowans who buy their own health insurance. And that's expected to affect about 80,000 Iowans. Some of them will see their rates go up over 20%. According to Wellmark, this is the largest annual increase since 2006, and the troubling rise in premiums comes on top of an average 9.3% increase for individual policyholders last year and a 54% increase in rates for individuals over the past 5 years. So when asked about this, the company spokesman noted that this was not related to anything that we don't already deal with, and blamed increase in chronic conditions such as obesity and knee and hip ailments, as well as the price of prescription drugs and high-tech medical imaging. And this is what's very fascinating. He also said the real way to make insurance more affordable is to lower health care costs and require everyone to have insurance, which is one of the very points that we have been struggling with in this debate over how we address the problem of providing access to health care coverage for millions of Americans. So I think Iowans want to know exactly why companies like Wellmark and WellPoint are raising rates on these individual plans and what factors went into their decisions, because everyone who's affected by this deserves a detailed justification for the increases from their insurance companies. They deserve to know that their elected officials are working to ensure appropriate and adequate oversight and regulation of the insurance industry and working to ensure that they have access to quality, affordable health care. That's why I believe this hearing is a good first start, but it's also one more example about why we need comprehensive health care reform in this country. All Americans deserve access to quality, affordable health care coverage as soon as possible, and unless we look at all the contributing factors, including unregulated high increases in health insurance premiums, which have been going on for decades in this country, we're never going to get at the root of the problem, and that's why I look forward to the testimony of our witnesses, and I yield back.